I want to talk a little bit now just about stem cells
Yeah.
and the biology and what they are and where they are in our body. And so, yeah, if you don't mind, just edu-
I'm a blank slate, by the way.
Yeah,
Blank
that's
slate.
perfect.
yeah,
No, that's perfect.
educate us, educate the people, please.
Yeah, I mean, I think the easiest way to describe it for the blank slates out there, right, is that just imagining taking an area that has damage, right, and as we injure or as we age, even the ability to repair some of those areas, it's diminished over time.
Mm-hmm.
We lose that capacity, right, or else we would all just be living like Wolverine and forever, right?
That'd be awesome.
Which would be great. That's next on my project. But so the blank slate version of it is basically transplanting those restorative cells from one part of the body and placing them where they can be functional again. The deeper conversation to that is that there is a lot of both information within those cells that get released, that get consumed. They eat up bad inflammatory cells, and sometimes when pain and inflammation happen, they happen in cycles. We were talking about something in cycles before, but that's a lot of life, right? And that's a
Mm-hmm.
lot of injury. So to be able to get somebody broken out of that cycle is a big piece. And I really look at what I do as sort of like I just sort of like crack the seal, right? I try to get him out of that habit of inflammation and pain. And then, I think there's some really critical um, roles in getting somebody from injury through stem cells and then functional again. And I know you guys have had physical therapists on before and having that conversation, which is a big portion of this. And then, of course, ultimately getting people to come see people like you. So if we can somehow keep them in the quote unquote good cycle,
Mm-hmm.
right, and maybe using stem cells to initially crack the seal, and then put them in that pipeline. I mean, I think that's the overarching conversation.